Hi, I'm Dr. Julie Steinauer. You know I love my success stories, and today I'm sharing multiple. All right, so let's hop into another one. Before I do that, I want to talk with you about how you can connect with us. If you're local, call us at 618-288-1489. If you're not local, go to our website, visionforlifeworks.com, and you can do one of two things. Either you can click on the schedule a consultation and schedule a time to talk with me directly about how we can help you, or you can go and click on the button that allows you to fill out a questionnaire, and there's lots of information there that will feedback and give to you about what's going on with your vision. Okay, so let's give you some information about this patient. She had a stroke, and due to the stroke, she suffered from what's called a homonymous hemianopsia. A hemianopsia occurs where one half of the visual field is missing. So if, for instance, the stroke occurs on the left side of the brain, the right side of the visual field goes missing for each eye. And so after 6 weeks of phase 1, which for us phase 1 is syntonics only, where we are electrically triggering the brain to kind of bring things back. We're increasing blood flow to the area where the stroke occurred, and we're also increasing all nerve connection and activity that occurs within the brain, so including those visual pathways that were affected by the stroke. And when we do that, we have some pretty awesome results. So after 6 weeks of just phase 1 syntonics, Michelle is noticing that in the lower right quadrant of her right eye, not necessarily here for this one quite yet, but for her right eye, that she's able to see things. So for instance, where it was completely missing and it was blank before, when she tried to look in that area, she wouldn't see anything at all if she was looking straight ahead and kind of like, you know, can I see anything down here? She wouldn't, because that entire right side of her visual field was missing. Well, now if she's looking straight ahead and she has some contrast, like light coming in from a window or light whenever she's doing her syntonics, as she's looking straight ahead, she's seeing, okay, something is there in my periphery. I might not be able to tell exactly that it's a hand or that it's a pen, right? Or that it's a sticky note. Okay, but there's something there that I can now visibly see is coming into the line of sight. So this is a really exciting thing. She says it's fuzzy, it's not clearly defined, and she's not even sure she would know that it's her hand, right? Because she's just kind of starting to get some of that area of her vision back. But that's exactly what happens when we're doing remediation for a visual field that's lost post-stroke or post-traumatic brain injury, is that the brain won't necessarily bring the details just back, you know, instantly. You won't all of a sudden, you know, with that visual pathway just go, oh yeah, my hand is right there. Oh, I can see it perfectly. It kind of starts coming back in the area of the homonymous hemianopsia, or sometimes it's a quadranopsia where it occurs in just one quadrant of each eye. Okay, so the brain will kind of, the way it brings it back is fuzzy and ill-defined or not well-defined at first. And so the patient or individual will kind of start saying, like, there's something there, I can see something there, I'm not sure what it is. Might even look annoying, you know, be annoying to them that they can kind of tell something's there, but they can't really see what it is or like scan in on the detail of it quite yet. But as time goes by and as the visual pathways are kind of more healed and restored a little bit better, and the brain is able to perceive that information more, then what occurs is now, instead of it being just like a fuzzy something's there, oh, well, that might be a hand, you know, oh yeah, that's a hand, okay? So then they can start to kind of get things at first fuzzy and ill-defined, then more and more clear. And what's interesting is as an area opens up that's fuzzy and ill-defined, when it starts to become clear, there's gonna be another area next to it that will become fuzzy and ill-defined. And then that area will get clear, and then there'll be another area that's fuzzy and ill-defined until it works its way through, and however much of that visual field is capable of coming back will actually return. We tell our patients it's really not a matter of if it's going to return or not, it's more a matter of, are you going to stick with it? And, you know, how long will you keep it up? Some of our patients even graduate our program, but they still continue to have success improving their visual field and seeing some of their visual field return even after they've been finished and done from our program for 6 months or a year. You know, we'll get emails saying, Dr. Steinauer, I just wanted to show you my newest visual field. Look at this. Another 30% chunk of my vision is back in comparison to when we stopped your program. So the brain has this amazing capacity to heal. Not in every situation. That's where it's important to connect with us so we can talk to you about whether or not it works for you. But in most situations, as long as you're not giving up and you're working at it and you continually do the activities that will kind of stimulate the brain in those areas for you to see again, then you should be getting some of your visual field back, whether that's 10%, 80% or more. We don't know, but there are some things that we look at that tell us whether you're a good candidate for 10, 20, 30% versus say 50, 60, 70, 80% of your vision to come back or more. Now for more information, you obviously can connect with us. If you're local, call us at 618-288-1489. If you're not local and you're not in this kind of like tri-state, bi-state area where you can get to us easily, then you want to go to our website at visionforlifeworks.com, and you have two choices. You can either, fill out a questionnaire and get a little bit more information and input from us about what could be going on with your vision and how it's affecting you, or you can click on the schedule a consultation button and schedule a consultation directly with me. Now, if you schedule a consultation with me about this, what we need you to have is a copy of your visual field. I want to see from the doctor's office that you had that that tested, and where is that homonymous hemianopsia occurring at, or that quadranopsia, where is that occurring at, so that we can take a look at that before we go through the consultation with you. So make sure you have that in hand, and you can either send it to us or you can show it to me whenever we're doing the consultation. Now, if you like this video, hit the like button, subscribe to our channel, obviously, so you get more notifications of all of our videos. And if you feel like this could be beneficial to someone, maybe they've had a stroke and they've lost vision, or they had a traumatic brain injury and they lost vision, please pass it on. Their ability to gain back, even if it's 10% or 20% of their vision, could completely change their lives. Thank you.